Let's talk about what you do when implants don't end up in the right position or the same position. Anytime you place breast implants, your body is going to wall off that implant with scar tissue, and that's the same for any type of implant you have placed in your body. Now, as the breasts move around, they're gravity dependent, your muscle strength may be different side to side, your handedness, there's going to be differences in how that scar tissue forms and how that scar tissue settles. So it's decently common with breast implant surgery that they don't settle to where we want them to, the implants, or that they settle unevenly. So the most important thing when you have this happen is that your plastic surgeon diagnoses what the problem is, because you always want to make sure that the issue isn't a contracture. You can have capsular contractures on both sides or one side, and it's very important that you rule out that as a problem because the treatment is so different. I have lots of videos about contractures. Once you rule out contractures, then you have to figure out what exactly is the problem. So with submuscular implants, you want to make sure that the muscle was properly released on both sides and that the muscle is not overly tight. So those two things can end up with the implant being held chronically high. When the muscle's not released enough, unfortunately, you have to go in and release it more if you want to fix that problem. And then if the muscle's holding everything up, then you have to figure out how to get it to come down. If the implants are textured, often I find that surgically is what you need to do. If the implants are smooth, you do have a chance of potentially getting them to fall. And you'll see surgeons do all kinds of things. They'll have their patients massage the area, massage down. They'll have their patients wear a band and sometimes even use muscle relaxant medicines in order to cause that muscle to calm the heck down and allow the implants to drop. You also rarely can use Botox to partially paralyze the muscle so it's not being so feisty, to allow the implants to fall. And then once they fall, settle, and stretch that lower scar tissue, when the Botox wears off, usually things don't happen again. They just stay where they're supposed to. Now, sometimes the patient just has a really short nipple to crease distance. So this is common in tuberous patients, but some people are just built this way. And when this happens, the implant often looks high, but it's really not high. The problem is you don't have a lot of lower pole tissue, and it's just time that will make that better. So in general, the more time you have the implant, the more gravity and force that is pushed on that lower pole of your breast, it will stretch out and will not appear so high. And then finally, bodies are just weird, and sometimes they heal strangely, and we don't know why, and one will be a little higher than the other one. Often tincture of time is the best medicine. If you wait a year, 18 months, usually things will just even out with time. There's nothing you really need to do. You just leave everything alone, and somehow it figures it out. If it doesn't, then you have to go back in and pull everything down. And when I say pull everything down, I usually mean you go in and you have to make cuts in the capsule to allow it to expand so the implant can fall farther down into the breast. So from an asymmetry standpoint, every human in the world is asymmetric. No one's implants are perfectly symmetric. If you know what you're looking for, you can always find slight asymmetries. Having major asymmetries after implant surgery is not common. Minor ones are very common. And like I said, the longer you wait, most things just figure themselves out. But all of those things I mentioned prior in the video need to be ruled out during the healing process because you want your surgeon to help you figure out whether it's a problem that has to be fixed or a problem that just needs some time.